Welcome back, everyone. Hope you had a nice little break there after some lunch and then a beautiful practice and experience with Andrea. We are going to welcome her back again. Let me give you a little bit more information about Andrea. She is the Clinical Associate Professor of Psychiatry at the University of British Columbia and practices inpatient psychiatry at Vancouver Hospital. Now, she has 15 years of outpatient psycho-oncology experience. Since 2006, she has facilitated group and individual mindfulness-based treatment programs for a number of things: mood disorders, sexual medicine, and oncology populations, using both mindfulness-based cognitive therapy, that's MBCT you've been hearing about, and more recently, mindfulness integrated cognitive behavioral therapy, that MICBT, that she is going to tell us more about. About her lecture today. This really is sort of talking about mindfulness for burnout prevention in healthcare providers. And as you know, Andrea did widen that definition a little bit from, doctors and nurses and therapists to all of us that might be providing care. The workshop offers a space for clinicians and others to step back, reflect on burnout, learn about mindfulness-based approaches to resiliency, so that we can be wiser in the work, more connected to colleagues, patients, friends, family, and ultimately able to find greater satisfaction in doing what is needed to be done. We'll be drawing, as she mentioned, on mindfulness integrated cognitive behavioral therapy, an integration of mindfulness meditation practices, and elements of cognitive therapy to offer a sort of different way to identify and encounter habitual patterns of thinking, feeling, and behavior that can lead to overwork and stress. And this will be news you can use. There'll be specific evidence-based mindfulness practices that counter each of the three main elements of burnout that she will be reviewing. So we've got another good half hour with Andrea. Welcome her back. Thank you.
Thank you so much, Ken. Can you see me and hear me clearly?
Everything is just as it should be.
Wonderful. I'm really excited to be here today with you all to look at how mindfulness can be helpful with burnout. And I'm grateful to TIES, Alberta Mind Biotech, and Alberta Health for this opportunity, for creating this amazing conference for all of us to join on these important topics. So I'll take a moment to share my slides. And my intention today is to distill key learnings from my experience, my personal experience of mindfulness practice, and of training hundreds of clinicians in how to deliver mindfulness-based treatments to support you in using mindfulness as an effective tool in maintaining resilience while navigating the many challenges that life brings, with a focus on burnout. So we'll start by looking at burnout and how its three main components of emotional exhaustion, cynicism, and a lack of feeling of personal accomplishment and how they develop. And then we'll review a psychological model, the co-emergence model of reinforcement, that demonstrates one way that mindfulness skills work together to decrease habitual distress and reactivity and improve skillful responses to stressful situations. And one of my favorite parts we'll get to touch on, which is the neurobiology of research into brain changes with mindfulness training. And it doesn't even take that much mindfulness training to make changes in the brain. And finally, I'll talk about some of the recent research on burnout and mindfulness, and we'll look at which specific mindfulness skills are most effective for each of these three components of burnout: the emotional exhaustion, cynicism, and lack of a feeling of personal accomplishment. So we should start out by acknowledging that not all stress is bad. Healthy amounts of stress or eustress can contribute to mental and physical well-being and even high levels of job satisfaction. But unchecked, chronic stress can lead to burnout. As an example, for healthcare professionals, at least 1/3 of physicians in the US and Canada report clinically significant levels of burnout. And this has many ripple effects in the system, including short staffing and poor, worse patient outcomes, and many, many more. Stress is also a significant contributor to depression, anxiety, and suicide. So both personal and clinical negative impacts. This figure from Shanafelt and Noseworthy beautifully summarizes the key drivers of burnout and its opposite, engagement at work. So, as the figure illustrates, the more favorable organizational culture and values, for example, or the better control and flexibility staff have over work factors, or increased resources available to staff, the more optimal engagement is and the more healthy everyone is. And of course, on the flip side, perhaps the less efficient the workplace is, the less supportive the community at work, or the more unbalanced work life integration is, the higher the risk of burnout developing. So, what I hope to put together for you by the end of our time together is how mindfulness supports us in more effectively working with the systemic factors. So we're not using mindfulness as a way of being Pollyanna-ish or pretending that everything is better. We're using mindfulness to create systemic change. Some of you may be familiar with the exhaustion funnel from the mindfulness-based cognitive therapy, the MBCT manual, which illustrates how with burnout, our lives become increasingly narrow and restricted. We give up doing activities that usually nourish and replenish us, and physical and mental health symptoms accumulate. Mindfulness is being increasingly recognized as training skills that are very effective in increasing self-awareness and self-regulation. And I've included this slide to show that even professional organizations such as the Canadian Medical Association are now formally recommending mindfulness as part of an approach to well-being. So again, mindfulness on its own doesn't magically result in systemic changes that need to happen to address those workplace drivers of burnout, but it does support each of us on an individual level to be more responsive rather than reactive, and to more effectively discern and implement changes that are needed for that effective system change. So, what is mindfulness? Take a careful look at these two images. Which one of these individuals is being mindful? Is it the one that's seated or the one that's walking? Maybe both? Maybe neither? This is a bit of a trick question. And I've included this slide, these images, to emphasize that mindfulness is all about how we relate to our experience, not what we are experiencing or doing at the time. So the seated woman who looks all blissed out, she could be planning her next presentation at work. And the one that's walking down the street looking at her phone could be mindfully aware of the intense emotions and physical sensations that are bubbling up as she reads her email, and she could be bringing a welcoming, spacious attention to them. So there really are many myths and misunderstandings about mindfulness that are propagated in the popular media. And these myths can influence our experience of our meditation practice. You've probably heard friends or family, or even had this experience yourself, that mindfulness didn't work for them because they didn't feel relaxed or calm when they practiced, or that they weren't doing it right because they couldn't stop their thoughts. Mindfulness isn't a way to fix our experience to make it be more like we think it should be. And of course, it's also not a form of positive thinking. So before we talk a little bit more about burnout, I want to take a careful look at what is mindfulness. And there's many definitions of mindfulness out there. I'll share with you today one that I found to be most clinically useful and that I work with my patients and group participants. It's mindfulness as an alert, receptive, equanimous observation of our present moment experience. Now you might be thinking, okay, I've got alert, that's not sleepy. I understand receptive, that's open-minded, welcoming. But what does equanimous mean? Equanimity is very hard to say. So a technical definition of equanimity is to, without reactivity, bringing an equal, objective, kind interest to our experience, whether it happens to be pleasant, unpleasant, or neutral. And that's still a mouthful. So let me tell you how I remember what equanimity feels like, and how I remember sort of how to do it. And perhaps you can each think of an experience of equanimity that you've had in your own life that you can remember as a reminder of what it feels like. So I have 3 children. So let's pretend that I'm calling them down to the dinner table. One of them has been the perfect child today. They finished their housework in the morning, um, did their homework without complaining, volunteered to do extra chores around the house. And the second one has been the opposite. And they picked fights with their siblings. They made a terrible mess in the kitchen and they whined incessantly. The third child, the eldest, wasn't around. Maybe they were studying in their room. Maybe they were in pre-pandemic times at the library. I'm not sure where they were. So I have one pleasantly behaving child in the moment, which I want more of, one unpleasantly behaving child, which in the moment I want less of, and one neutrally behaving child, which is neither here nor there. I don't even know where they are. Now, here comes the equanimity part. This is where we're going with this. When all 3 of them come down to the dinner table, I serve each one the same nutritious meal. In other words, I treat each child with the same kind, objective interest, without reactivity, regardless of whether I experience them as pleasant, unpleasant, or neutral today, and without using my interaction with them to further a sense of self or propagate a narrative, a story about my experience. Like, oh, I'm such a good mom, they're behaving so well. Or I'm such a bad mom, I must be, they're acting so terribly today. Or I'm so sad, they don't even need me anymore, I don't know where they are. So the question is, how can we use this alert, receptive, equanimous observation during the day so that we aren't as emotionally exhausted by the end of it? This first component of burnout, emotional exhaustion, is so draining. As a burnt out medical student, I remember wishing that I could be the patient lying in the hospital bed because I really felt like I had nothing left to give. Over the last 5 years, researchers have been looking at which specific parts of mindfulness lead to improvement in each of these 3 burnout dimensions. And Kinnunen and her group found that for emotional exhaustion, of all the mindfulness skills they looked at, it was refraining from criticizing or evaluating our inner experiences. In other words, our thoughts and sensations, emotions in our bodies, that was associated with the greatest improvement in emotional exhaustion in 10-month follow-up after mindfulness training. And of course, there are 2 main ways to train mindfulness skills. Formal mindfulness training, often these practices last 10 or 20 minutes or longer. You can think of this like going to the gym of the mind for a workout. Could be a movement practice, body scanning. And then there's applied mindfulness practices, where we take these skills and apply them during the day, like taking what we trained in the gym and applying it to having good form, good posture when unloading the dishwasher. And one example of an applied practice is this 30-second mindfulness-based interoceptive exposure task, or MIET. Those of you who joined the lunch hour practice have had the opportunity to practice the MIET. The MIET is used in mindfulness integrated cognitive behavioral therapy to train non-reactivity and acceptance and equanimity throughout the day, such as when those 3 children come to the dinner table. We reviewed at lunch that it's the co-emerging sensations in our bodies, those unpleasant feelings of stress that come up during difficult situations, that are the most effective object or focus for our mindful attention. And briefly, we review that we become aware of the most intense sensations. We then mindfully observe these in a very specific way using the 4 basic building blocks of sensations, and calling the sensations heat instead of anger or heaviness instead of sadness helps us take them less personally. And then responding skillfully as it no longer feels so urgent to need to react to make the sensations go away because we're welcoming them. So the MIET is an example of a 30-second skill, mindfulness practice that we can bring into our regular workday. When checking emails, for example, or standing in the elevator or having a conversation with a colleague. And the MIET is very effective. It's been studied in chronic pain populations, for example. And in this study with chronic pain patients, the Miette practice was the only mindfulness practice that participants were taught. It was the only mindfulness they did. And as you can see, both pain severity itself and pain-related anxiety, also emotional distress, though not on this slide, decreased after 2 weeks of treatment and continued to decrease impressively at 2-month follow-up. So if we're using mindfulness as a way of coping more effectively with this loop of reactivity, with stress and burnout, it can be very helpful to understand how mindfulness has its beneficial effects so we can embody it more effectively. And one framework that I find very helpful to explain how mindfulness works is this psychological model called the co-emergence model of reinforcement. And if you look carefully at this slide, you'll see the same 5 steps in the co-emergence model as we had with the parent and child in the previous slide, including the evaluative thoughts, I should have left more time, the co-emerging sensations in the chest or gut, and the reactivity, the irritability and snapping at them. This psychological model is the foundation for mindfulness integrated cognitive behavioral therapy, a 9-week mental health and well-being program that can be applied to many human experiences, as all of mindfulness can, whether anxiety, addiction, trauma, chronic pain, personality challenges, stress, depression. MICBT has several unique features in that it focuses on the development of equanimity and increasing our ability to feel sensations in our bodies. A bit more on that later. So I'd like to go through these 5 steps of the co-emergence model and then show you how mindfulness affects how our body processes stress, including some of the changes that happen in the brain. So starting with the situations that we encounter, we experience these through our 5 senses, and through the sensations in our body, it's how we know whether we're hungry or happy, and awareness of our thoughts. And all of this incoming information is filtered along a continuum of personal importance. How important is it to me? On one end, there's the neutral factual information, like there's a door behind me right now in this room where I'm presenting. And on the other end is the I, me, mine thoughts. What does it mean to me? What's the relevance, the implication for me? Now, if a fire suddenly started in this room where I'm presenting, all of a sudden the location of the door is no longer a neutral fact. It's now moved along the spectrum. It's very important to me. So where this becomes important is that the more of a sense of I, me, or mine there is in our thoughts, the more likely that emotions and associated bodily sensations will co-arise. And you can see here that our sensations are not directly determined by the situation itself, but rather by the meaning that we assign to that situation. And the more agreeable it is, the more pleasant the sensations, the more disagreeable the thoughts or meaning, the more unpleasant the sensations. And this, of course, leads to a reaction. And we want more pleasant sensations. We'll have attachment reactions. Perhaps one more serving of food, one more episode on Netflix. And attachment behavior is positively reinforced each time a pleasant sensation is successfully maintained or increased. And similarly, intense, unpleasant co-emerging sensations lead to aversive reactions, avoidance, a glass of wine to remove sensations. And here is the key part. Mindfulness helps us stay with the co-emerging sensations in the 4th box instead of automatically moving on to reactivity. We learn to approach our internal experience with equanimity, that equal interest to pleasant and unpleasant, rather than trying to avoid or change the situations in some way. And some of you are probably noticing that this 4th box, the co-emerging interoceptions, is where we apply the Miette, those 30 seconds of welcoming sensations as they are. So with chronic stress or depression or burnout, this information processing system can get stuck in a state of disequilibrium. We're less aware of our immediate surroundings. There's great research on that I don't have time to present today. We find ourselves relying more on the fast I, me, and mine implicational thinking. And what happens to the fourth box, the co-emerging interoceptions? It gets smaller. We don't feel as much of what's going on in our bodies. And this makes sense from an evolutionary perspective. When we're running away from a bear, we don't want to be distracted by scratches from branches or mosquito bites. And we react quickly, maximizing safety behaviors, getting more of what we like, what's safe, what's pleasant, and less of what we dislike, what's unpleasant, what's dangerous. Does that sound familiar? Can you recognize some of that in your experience? And we can get stuck in this unbalanced state and start to personalize even neutral events, becoming more and more reactive. So let's look at what happens in the brain with this stress response. The default mode network is made up of a bunch of brain regions that work together to do the heavy I, me, mine lifting of the brain. And the default mode network is active when we're thinking about ourselves, when we're self referencing, and it's heavily involved in our sense of self and the beliefs we have. So it's not surprising that study after study shows that the default mode network is overactive in both acute depression and anxiety, and in chronic pain, chronic stress, chronic depression. The list goes on. Here's a sobering study. The default mode network remains overactive even in people that were depressed and have now clinically recovered. In this study, in recovered non-medicated patients, they were asked to do a mathematical task requiring concentration. And their concentration was not as good as controls, in part because their default mode network, those I, me, mine thoughts, were on overdrive. The default mode network is supposed to shut down when we need our attentional resources elsewhere, like for math, but for them, it wasn't able to. So I'd like to share one more brain network with you. And Dr. Kaiken, William, mentioned the importance of the salience network this morning. It's shown here in the middle square, and it's placed between the default mode network on the left and the central executive network on the right, because it plays a key role in balancing these two opposing activities of thinking I, me, mine thoughts and task-based activity. The salience network, its job is to assign relevance to us, to figure out what's important in all the incoming information's going on. Like, is the door behind me, is that important or not? Whether it is, it's going to depend what's going on in the room. So the salience network then activates the default mode network or the central executive network accordingly in order to guide our behavior. So in a little bit more detail, the salience network is made again of many brain regions, and there's this lower one, the lower blue dot. In that area, that's the anterior insular cortex. And this is a very important part of the brain. It receives all of the incoming information from our body about our internal emotional and physical state, including those co-emerging sensations. And it integrates this with information from our five senses and from our thoughts, from what we know is going on. And it then makes its decision. Is this a big deal or not a big deal? It decides how relevant or salient that information is. And you'll probably not be surprised to find out that in depression, the anterior insula is hypoactive. It doesn't work well. It can't effectively regulate the balance of the default mode network and executive functioning. In a recent meta-analysis by Goodkind's group of over 7,000 psychiatric inpatients found one consistent feature across a range of psychiatric diagnoses, which was the reduced size and activity of the salience network nodes. And much more research followed, and we now know that the loss of structural and functional integrity in the salience network is a transdiagnostic finding across many psychiatric illnesses. So where a lot of mental health interventions are moving now, and where mindfulness is so important in mental health, is in acknowledging the importance of the body, bringing the body back into the picture, relearning how to feel with receptivity, with welcoming sensations rather than with reactivity. So let's go back to what's happening in the brain with chronic stress. There's an increased reliance on the default mode network for interpreting situations. Those are the self-referential ones. And there's decreased functioning of the salience network. It can't do its job as well. So there's more reactivity. As a result, decision-making is less rational, and we rely more on habitual reactive behaviors. And the more that unpleasant physical sensations and thoughts are resisted and avoided, the more this disequilibrium in information processing is perpetuated. So how can we change this? How can we bring the brain back into equilibrium? So you've got it. One way, there are many, but one way is to take our brains to the mindfulness gym to help bring these different parts of the brain back into balance again. For example, more and more research is coming out about the importance of being able to feel sensations in our bodies, as I'd mentioned earlier, about the importance of this anterior insula. This example is from a 42-year-old man with chronic anxiety. On week 1, before he started body scanning practice, he was hardly able to feel any sensations in his body. But after only 4 weeks of practice of twice-a-day body scanning, in this case in the mindfulness integrated cognitive behavioral therapy method, he was able to consistently feel subtle sensations throughout his body. And this had an impact on his ability to self-regulate and to decrease his reactivity. This study by Brewer found that meditators had decreased default mode network activity regardless of what kind of meditation they did, whether it was choiceless awareness practice, just focusing on one's experience, or a loving kindness practice like we've had the opportunity to experience, or a concentration practice. And meditators found that their mind wandered less, and they were more able to disengage from self-referential thinking. And the last slide on neurobiology that I'd like to share with you is that meditation can also change connectivity of the large functional networks of the brain. Sometimes I get asked by clinicians who come to a 5-day fostering resiliency retreat whether 5 days can make a difference. They're just beginners, or people who are just learning to meditate. And this 2016 study by Cresswell gives us some answers to that. He took newbies to meditation, literally took people off the street and put them in a 3-day mindfulness meditation retreat and compared them to another group that he took off the same street and put them in a relaxation retreat. And he found that in only 3 days, those in the meditation group had improved connectivity, better balance of functioning between the default mode network and the central executive network. And this lasted at 4-month follow-up. And at 4-month follow-up, after only 3 days of meditation, their emotional regulation improved, executive functioning improved. And this was the first study to show that their cortisol level decreased and their biomarkers IL-6 of inflammatory disease risk decreased. So to summarize some of the ways that mindfulness can help change our brains to support balanced information processing, sensory perception is enhanced through improved functioning of the somatosensory networks. Self-referential processing decreases. Interoceptive awareness is enhanced in part by increased insular size and activation, and reactivity decreases in intensity and duration. We have a lot of research showing that when people do get emotionally reactive, it doesn't last as long. So now that we've gone through these 5 boxes of the co-emergence model, I hope that you can see how some of the mindfulness skills that we train when we practice mindfulness, how they actually relate to improved mental health. Maintaining concentration on this moment helps us be aware of the situation as it's happening. Observing sensations improves interoceptive awareness and emotion regulation. Recognizing thoughts just as thoughts helps us decrease our identification with our experience and our schematic beliefs, and practicing a real receptivity towards pleasant, unpleasant, and neutral develops kindness and equanimity and improves emotion regulation and affect tolerance. And all of these skills together help decrease reactivity, decrease avoidance, decrease the size of that fifth box. So in our last few minutes, let's come back to looking at burnout. The second factor of burnout is cynicism, characterized by irritability, loss of idealism, withdrawal, and negative attitudes towards clients. It's been described as a form of defensive coping associated with more employee turnover, and it's more likely to arise if there's a lack of congruence between personal and workplace values. Interestingly, the mindfulness skills that have been found to be most effective in addressing cynicism is this non-judgmental approach to oneself and compassion. And yesterday, Noriko guided a workshop on compassion, and today, Rosamina spoke to us of compassion and loving kindness practice. And I encourage you to try different kinds of loving kindness practice and find one that is a good fit for you. And finally, burnout. This third factor of burnout, reduced professional efficacy. This captures how we experience the value of our work and the contribution we make. And interestingly, for healthcare providers, research literature on burnout has found that it's problematic relationships with managers and colleagues that's the biggest contributor to this third component, rather than demands from patients and families. And this makes sense, as our colleagues are the most relevant source of information for us, for our sense of efficacy in our professional lives. And when those relationships are strained or absent, it's difficult to find meaningful confirmation of our job performance. So one mindfulness tool that we can use to work with this feeling of reduced professional efficacy when it does happen is this wonderful tool developed by Michelle McDonald with the acronym RAINDROP. And the RAIN part of the acronym guides us in processing and examining our experience. And the DROP part of the acronym reminds us when to bring mindfulness to our experience. And I'll share these slides with the conference organizers so that they can make them available to you after the day is over. So I'd like to end with talking about the many effects of when we bring mindfulness into our daily lives on a regular basis. We're able to make even small shifts in how we relate to our own internal experience. And we then bring this to our interactions with family and friends, our workplace. And we can then be more available for exploring and implementing systemic change at the level of making changes in systemic drivers of burnout that we talked about at the beginning. And the most important part of this is regular mindfulness practice, taking care of ourselves. And I hope that many of you will be able to attend one or both mindfulness practice workshops that Rosanna is kindly facilitating tomorrow. So I'd like to end with expressing my gratitude for the teachings from my mentors, teachers, patients, and colleagues from whom I've learned, and now been able to share some of these learnings with you today. And also to thank you for attending this conference, for bringing your attention and interest to this important topic of mindfulness and mental health.
Thank you very much, Andrea. That was terrific. So much. You know what I loved? Here's what I loved. The credibility of the brain science. You've taught me something around, I hope you've taught everybody, something about the sort of, the brain science that is behind this. I actually had a colleague, I'll be straight up with you, when I told him I was going to be involved in this conference, he said, that sounds a little new age. Is that real? Well, I think you've given us a sense that this is deep, meaningful work, and it's evidence-based, and it's rooted in true science. And I think that's a one of the many services you've done for us today. I wish we had a little more time for questions. We don't. We want to move through. There's still a few speakers, and we want to move through that. So thank you very much. If you do have a question for Dr. Grabovac, please insert that into the chat. I'm sure she would be happy to engage with it. Thank you so much. We really appreciate your contributions.
Thank you, Ken.
Excellent.